Hey, I want to thank you again for joining us for the Local Loop. The Local Loop is an online conversation with community leaders as they walk through the difficulties of navigating the COVID-19 pandemic. It's a pandemic for sure. I can't even get it out. We also want to use this time to help keep you in the loop as to what's going on and what resources are available. So each episode, myself and Bryan, the lead pastor of Oak Ridge, will host local community and business leaders to see how they are navigating through this time and what you need to know. Today, I'm excited to announce that we have Dr. Michael Finegan. Dr. Finegan is the Executive Director of Peninsula Mental Health and Peninsula Addiction Services. Dr. Finegan, it's a pleasure to have you today. Thank you so much for taking some time to join us.
Thank you for having me.
Hey, Peninsula Mental Health and Peninsula Addictions has been a leader in our community for helping people. Tell us how is COVID-19 affecting your organization and how are you navigating and adapting to that?
Well, navigating by making sure, first and foremost, that I'm taking care of my staff and myself as we are navigating, trying to help the community. It's so important to recognize, to avoid the primary leadership failure, which is a failure to take care of self when we are in these very, very challenging situations. So we're balancing between taking care of our patients, taking care of our community, taking care of our staff, and taking care of myself.
That's quite a challenge. And I was talking with my wife about this. It seems like crisis calls specifically for a time for leaders to step up in a way that is, quite extraordinary, filling the gap. And you see that in a lot of the, in the mayor that we spoke with. You see that obviously in Governor Hogan and President Trump and Pence, and each of them have mentioned the incredible toll that it's taking on them physically. How in the world do you do self-care as a leader in a time when in fact you need to be on almost 24/7?
I've been very grateful to have the opportunity to serve throughout the world in major disaster situations where there's been massive loss of life and where the disaster has gone on for weeks. And so I've learned from the lessons of leaders that I respected and what they did that worked and what they did that didn't work. And what I've seen throughout the world in these disasters in the Philippines, in Haiti, in Sri Lanka, in Puerto Rico, is that the failure to take care of self results in the leader not being capable of sustaining the mission. These are in highly dedicated, highly competent individuals in significant positions of leadership where they fail to sustain the mission simply because they have failed to take care of themselves. It's such a simple concept, but very difficult to apply. And so I use those experiences with men that I had and women that I had tremendous respect for and where they faltered. And so as I'm trying to have people that I'm responsible for to apply that self-care, I say to myself, if I don't do it myself, for myself, I'm being a hypocrite. So I use that to strengthen my resolve.
So what would you, if you were giving counsel to some of these leaders like Governor Hogan and you saw the wear and tear beginning to take its toll, what are a few things you would tell him, hey, you need to be sure and do this to take care of yourself? What are some practical things that you would ask them or tell them that they should be doing?
Well, first, that you're having multiple sources of support, that it's not a single individual, it's a choir, it's a group that allows us to achieve this mission. And so what we do is that we engage in this responsibilities at the beginning of the day, but then we're utilizing the resources that are valuable to us. For some, that is prayer. For others, it is their family. For others, it's their aides. Pre-planning of pleasurable activities at the end of the day. I recall with the devastation of 30,000 dead in Sri Lanka following the tsunami, every evening and I would make sure that I would walk the beach, and I would make sure that there would be something that I would look forward to, because I saw what happened when the dedicated leader failed to take care of themselves. So we're relying on those trusted allies. We're making sure that we get adequate sleep, adequate food, that we are avoiding this idea of either we've succeeded in the mission or we haven't succeeded, what we refer to as black and white thinking. Because in major disasters, major emergency situations, what you're trying to move is the needle a little bit, right? You're trying to get down the road a little bit farther, as opposed to, did I accomplish or not accomplish, right? It is this self-reinforcement, this saying, you know, this was the goal for today, and we got that part of the goal accomplished. There's many things that we provide. I'm more than happy to expand on that, or you can ask me another question.
No, I appreciate you answering that, Michael, in the way that you did, and I think it's important because there's certainly leaders, you know, among our viewers right now, and I know some of that's going to help. And everyone that I've talked to that's in a leadership role, including myself, we have a tendency during times like this to throw, you know, all the boundaries aside and just kind of give of ourselves completely, especially when we're called into areas of service, and it can be dangerous, can it?
Correct. Leaders are generally not used to being out of control, and we don't have a completely controllable situation. So what I also try to do is to connect leaders. So I remember connecting the senior religious leader in the Philippines to a senior religious leader who had dealt with an emergency in Southeast Asia, to put the two of them together, so that the one that had experienced the catastrophic events and massive loss of life could share that wisdom. Been there, done that, bought the t-shirt. This is not an academic exercise. I mean, we have been here before, not in the United States at this level, but the world has seen this in a variety of different ways where there's massive loss of life. And we realize that the two primary leadership challenges is, one, maintaining a high degree of humility. Humility is manifested by being open-minded, by taking information, by being able to recognize what you need, what you don't know, and to be able to acknowledge mistakes so you can move on from those mistakes. Yeah. But to do that in a sustained way, you have to engage in adequate self-care. You have to eat. You have to take nutrition. Down in Haiti, where we had 30,000 people on a golf course, to about, at the time, it was believed that 250,000 people had died in the devastating earthquake in Port-au-Prince. But there was a colonel that was responsible for the 101st Airborne that was providing perimeter security for us. And he said, says, you know, I'm going to be the last guy in this battalion to take a shower, and I'm not going to have the best place to sleep. But I am going to eat and I am going to drink before some of my men, because I have to continue to lead. Now that's military leadership. That's drilled into them. But at this time, community leaders need to utilize the example of the United States military of how they train their leaders to sustain themselves in a long-term mission.
Wow, that's helpful, Dr. Finegan. Let me do this. You know, now that and maybe some of these same principles apply, but for our viewers who aren't leaders, the everyday person, you know, in our community here, who is struggling through this, you know, let me ask you this. One, people are alone right now. They're isolated. We're seeing more and more feedback from people that they're struggling emotionally. Two questions for you. One, is that normal? You know, for anybody who's watching that's feeling anxious, depressed, overly emotional, is that normal during times like this? And then two, what would be some things that you would recommend to them to do to help with that during this time?
So at this time of where we are isolated and where at this point in the pandemic, there are a number of people in this region who have lost people. Unfortunately, in the days to come, in these first weeks of April, more lives will be lost. So we recognize that feelings of anxiety, feelings of sadness are normal, but it's what we do with those feelings. And there's many things that we can do. A very powerful thing is to focus on that which we have control over and reduce our focus on that which we don't have control over. We tend to waste an awful lot of time focusing on things that we have no control over. Yes. When in fact, we have massive control over a variety of things, some of which we have total control over, and some of which we have partial control over. So with protecting ourselves and our loved ones from the coronavirus, we have absolute control over our teenagers and our adults that we care for in terms of the frequency with which we wash our hands and touch our face. We have a very significant level, but just not total control over our social distancing. When we go to the grocery store, there's a time of where somebody may intrude on our space. And that is why the wearing of the mask, if we have one, is very valuable. The structure and support. So having a structure in our day, that structure should involve taking care of ourselves by adequate nutrition, exercise based upon your level of fitness. So that may be for some people 15 minutes. For other people, that may be an hour and a half. But exercise is valuable. Okay? If we have a location where we can maintain and be assured of social distancing, being outside in our backyard, catching that sunshine is valuable. Developing some activity that is meaningful for us. Meaningful involves helping another human being. When we look at what is most meaningful in human beings, when you are doing something where you are helping somebody else, that tends to be inherently meaningful. Yeah. So spending a section of your day where you are reaching out, okay, to somebody that you care about, or somebody that is in need, maybe an individual who has just lost a spouse, or somebody that doesn't have children, is something that is meaningful and valuable to not only the person who's receiving that supportive contact, but it's also good for us because we're doing something meaningful. Another is to have something that is pleasurable and is just associated with pleasure. So there's people that are putting crossword puzzles together. There are people that are doing paint by numbers. There are people reading that book that they've not had a chance to read, or they're developing a hobby. That's one of the great benefits of our IT, of our computers, because we have massive access to a wide variety of activities. The family that prays together stays together. The family that is eating together. You're creating rituals of that support. And you're following the first rule of leadership. Right? All of us have the capability of being leaders in our own way. Leaders are not born. Right? They are created. Okay? So this idea, well, I'm not a leader. Well, you are in some way. No one goes through life without touching another life and improving it in some way. Even people who have lost their way, who have shame for having done something wrong. If they really take the time to look at their life, they can find some ways in which they have in the past helped somebody, touched a life. But that we need to do more of that during this time of the pandemic.
So those are some great things to help us reflect. And so many of that you just shared, I keep, I'm ringing, different verses in my mind. You mentioned things we would call the great commandment, to love your neighbor as yourself, and clearly the Serenity Prayer, acknowledging that there's a lot of stuff out of my control, and I just need to simply turn that over to God. But in the Serenity Prayer, I love the fact that he also says, but take responsibility for stuff you can control, and understand and have the wisdom to understand the difference. And so there's so many aspects there that you shared. I worry about, and some of the leaders recently, including the president and Governor Hogan, has mentioned that this pandemic is also creates a pressure cooker, that people who already were having some fractures in their own life and management, and maybe it was addictions, maybe it was domestic violence, that this is intensifying that scenario. Do you see that as a reality, that there's going to be, they're predicting now that there's going to be lots and lots of domestic abuse situations happening because of this pressure cooker, and lots of suicides and other, ramifications? How do you feel about that?
I think that there will be an increase. The degree of increase is unclear, but where individuals that are having challenges with interacting with others in a domestic dispute, for example, as tension increases, and we have not yet developed healthy ways of dealing with our anger, that there is an increase in domestic violence. Where we have clear objective data that supports some worsening is in the massive increase in alcohol sales, beer, liquor, and alcohol sales, where people, because of being cooped up and not having a diversity of activities, okay, are turning to alcohol. And for those individuals who are suffering from a history of substance use, right, this is not a moral failing. Right? This is a disease, but people are turning to maladaptive ways, unhealthy ways of coping with their anger, with their anxiety, with their fear, with their inability to resolve conflict. And they turn to substance use. And the data is showing that sales of alcoholic beverages has massively increased. That when there is increased stress, we can look from history, okay, that individuals who are on the edge and then are pushed beyond that edge because of financial concerns or interpersonal concerns, some of them become fatalistic. They operate on a false belief that they can't tolerate this. And then they see suicide as their only alternative. As the saying goes, a long-term solution to a short-term problem. Things change. One thing that is inevitable in life is that this too will pass. Okay? Things will change. But people have to reach out to their brothers and sisters and to their friends, to their ministers, to people that they trust, okay? Because they will take that hand, okay, and walk with them through this very dark or difficult time for them, okay? Because people can get better. Problems with anxiety, problems with anger, problems with relationships, problems with substances. People can get better if they get good care. Yeah. And that's what they need from multiple sources of support.
Well, Michael, let me ask you this. Someone's watching right now struggling with mental health. Is Peninsula Mental Health and services there, are you guys still open? Are you still actively helping people in our community? I mean, what can someone do if they don't know where to turn? We've got you here. What services are you guys providing that could be helpful to someone here in our community that's struggling with some of these issues?
So there's a wide variety of services that are available by us, and I know by the health department. I am unclear what other practices are providing. I know that the hospital is still providing inpatient care. But Peninsula, my practice, is continuing to provide both mental health care and addictions care, and it's all through telehealth. Where in a video conference, we are meeting with the individual that is suffering and establishing a plan. For those individuals who have very serious addiction problems where they have physical dependency on opiates, on heroin, on alcohol, that we are assisting in that process with medication, as well as trying to facilitate transfer into other programs should it be needed. But this idea that every individual that has a substance use disorder, that has the physical dependency, requires inpatient care, is not accurate with the use of these medications now that we have. It can be a chemical hospitalization. But people need to recognize, right, that there is help available. We've expanded our hours and our days of the week. We're taking care of individuals now on Saturdays.
That's great.
And we're still getting individuals in same day. All right. So, one of the things that we have really worked very hard on, my team has worked very hard on, is making sure that individuals that are hurting have rapid access. And all they have to do is call the number, and they'll have access through, I guess, your website or our website.
Yeah.
Well, Dr. Finegan, we certainly appreciate your time and giving us some time to just speak with you for a few minutes. I know this is going to be very valuable to a lot of folks, and so thank you for giving that time. I want to ask you one final question as we close up, and we've asked each of the folks that we've talked with in these conversations, what in your opinion could or should faith communities be doing during this pandemic?
Well, one is televising, streaming their services to increase the frequency with which they are streaming, so individuals can access, placing an archive of previous sermons or previous celebrations on the web, conveying information of hope and optimism. That we have links on our website that are called the ABCDs of Hope. These are particular skills that have been learned through the experiences of multiple cultures and multiple communities across the world that really make a difference in moving through difficulties. Also, that we've placed on the website articles that have been written. Recently, we've had articles in the Daily Times, in the Salisbury Independent, that provides a narrative, a story, that people can access that will give them information and skills, not just wishful thinking, right, but very specific skills that we can use. Addressing issues, anger management, acceptance, decisiveness of action, looking at things from a broader meaning perspective, or where we look at things from different angles, which gives us additional insights. There's many of these very concrete, very specific behaviors and things that we can do to help us through this challenging situation.
Well, Dr. Finegan, thank you so much. I don't know if we can pull back up the website address, but let me just tell you, if you're struggling, reach out to Peninsula Mental Health. I believe the website is penaddictions.com. Their phone number is 410-860-2673. They're a great organization. Don't do this alone. If you're struggling, reach out. It'll be the best thing that you ever did. Dr. Finegan, thank you so much. Love your heart. Love everything you do and how you're willing to help people and serve people. You're doing a great job, and thank you so much.
Have a good day.
Thank you. God bless you.
Thanks.
Thank you.